Hello, this is measuring oxygen saturation using a pulse oximeter. When we are using a pulse oximeter, the way that this device works is it looks at the red blood cells as they go by, and it determines the color, and then based on the color, how red is this red blood cell, it then does a calculation and determines the patient's oxygen saturation. So because it needs to look at the red blood cells, the person needs good circulation to the extremity where you're going to place this monitor. So this particular one is a clip. It goes on the finger. And so for this one, I'm going to check circulation to the finger. So I'm first going to touch the skin. Does it feel warm? I am also going to look at the skin and see that it looks the appropriate color. I'm going to check the capillary refill. It should be less than 3 seconds. And then I'm also going to check the radial pulse and make sure that it is strong. So I need to assess that circulation before I put this clip on the finger. If there is not good circulation to this hand, I'm not going to get an accurate reading. Then the next step is to look at the fingernail, make sure that there's no nail polish on or any false nails like acrylic nails. If you find that, that needs to be removed because the device will not work. Then the next step, once you have determined that there's good circulation, you remove the nail polish or any false nails, is to clip the device on. Now, so that you can actually see the device work, I'm going to clip it onto my own finger so that you can look at how it works. So it's a little clip. You just open the clip, put it on the finger, and once it's on, then you press the button to turn the device on. Once the device is on, you will notice there's 2 numbers. The top number is the oxygen saturation, and then the bottom number is the pulse. When you look at that pulse rate, you can check the radial pulse and make sure that the 2 match. If the 2 match, that helps you to know that this is reading accurately. The other thing you can do to help you know that it's reading accurately is you can look at the screen, and you will notice with each pulse, with each beat of my heart, the barcodes go up, and also you'll notice the little heart blinks. Those also help you to identify that this is properly reading the pulse and that it is giving an accurate reading of the oxygen saturation. We use this device to check people. When people come in for a checkup in a clinic or an office, they'll do this as part of the vital signs. We do it frequently in the hospital. We do it anytime we're administering oxygen or changing oxygen, taking it off or putting it on. We want to check the oxygen saturation right away so that we know how our patient is doing in regards to their oxygen saturation, because we know that oxygen is so important. And that's all there is to using this device.